I would now like to invite our esteemed panelists to please come on the stage. We have with us Dr. Sanjeev Kumar. He is the director of IIHMR Delhi. Dr. Sanjeev Kumar is an AIIMS New Delhi alumnus with 41 years of experience in public health across 29 countries. He has been part of UNICEF and has worked for 22 years as a health specialist. I would also like to call upon Mr. P. Balaji, the Director, Regulatory, External Affairs and CSR of Vodafone India. Prior to Vodafone, Mr. Balaji has also been the Managing Director of Nokia and Sony Mobile Communications in India. The next panelist whom I would like to call upon is Mr. Ajoy Khanderia, founder Grameen Healthcare. Ajoy Khanderia is an entrepreneur evangelist with a vision to reinvent the existing primary healthcare landscape of rural India. I would also like to invite Mr. Ravi Bhatnagar, Director, External Affairs and Partnerships at Reckitt Benckiser. Mr. Ravi Bhatnagar is a global public health and public affairs professional. The session will be moderated by our very own Dr. Bobby John, co-founder of the India Health and Wellness Summit. Dr. Bobby John is the founder and now principal advisor at Global Health Advocates India, a public health-focused voluntary group based in Chennai. He presently heads Equitas Consulting, a new health-focused think tank based in New Delhi. So let's kickstart this panel discussion.
Thank you, and a warm good evening to each one of you. Most of the awards are done, some conversation remains. And for that we have 4 very distinguished, experienced leaders in front of us. But before I turn to them, let me ask this room, there's some 200 plus, 300 people here in this room, and I can't see the lights. Can we have the lights just for a moment, please? Can we just turn on the lights in the room? Because I'd like to ask a question that way before I turn it this way. Anybody from the organizers, if I can have the lights, just so that I can see who people are. There's too much of lights on our face. Do you have a question for these panelists? And I want to take 3 or 4, which I want to weave in then into the conversation that we have. Because normally what happens is you have a panel discussion and then there's very little time for the audience to have even asked a single one. So I want to start the other way around, please. Do you have a question for any of these 4 panelists? And you've heard their descriptions of what they have been doing, why they are here, and what potentially could be their areas of interest. So anybody with a question that you'd like to pose to our panelists? Nope? Everybody's sleepy. People have got their awards in their hands, and so therefore they can't raise their hands. Going once? Yes, sir. Thank you very much. Gentleman there. Yes, please. Could you introduce yourself and then your question?
I'm Dr. Ajay Gambhir from Delhi Medical Council. I feel that CSR awards and the CSR activity, I am seeing less and less as far as where the country needs is the mother and the child, but it's more about the visibility. And I will say it's Mala, Manch and Mike. So I want that explanation. It's more about the visibility of the companies rather than real impact, because I've been working with a lot of government and a lot of international agencies. So it's a critical comment I will need. Yeah.
Thank you, Dr. Gambhir. Anybody else? Yes, ma'am.
Hello, everybody. I am Nidhi Mandelia from Empower. My question is with respect to what Dr. Nagar had just commented about, saying that why is it that in healthcare, treatment and diagnosis is not the focus and primary healthcare is the focus?
One last question. Anywhere? Going once? Going twice? And we are done. We've got 2 questions there, and those should be fairly meaty too here. Thank you, gentlemen, for being with us. And on my part, I'm a bit apologetic, not a bit, a lot apologetic that we have a completely skewed gender balance here. For health is not merely the domain of men. We need to do much better to have women up here also being part of this conversation. So with that, both as an apology and also as a request that we continue to look for greater leadership and voices from women on stages like these, let's start with folks. Grameen Health. Why Grameen? You could have been very happily been in California. You could have been selling chatbots. Why Grameen? Why here?
First of all, thank you for inviting me here. Second of all, I did all of those.
Yes.
Now that I'm done doing those things, I thought it's time to sort of do what really matters. The reason for Grameen is because we saw and heard a lot of horror stories about the plight of farmers when they are unwell. Our good friends at IFCO showed us all the different things that happen to farmers. So we said, let's try to do a little bit for them. And our focus has only been on primary care. Over a year and a half, what we learned was primary care in the rural parts of India with the farmers is still based on the age-old method of them going to the quack. And every quack in every part of the country is different, and they have different ways of dealing with it. Our Prime Minister has talked about digital India, inclusive India, etc., but I think we forgot the farmers and their healthcare somewhere down the road. So we said, okay, let's try to do whatever little we can do. We set up an institutional version of healthcare for rural India, and we focus only on primary care. And how do you make those people change behavior? It's not something that happens by magic. So what we did was we came up with an innovative idea of giving them a health card. We give a health card to a family of 4 for 120 rupees. That covers them for a full year of all primary health services. And out of that 120, we take 100 rupees as CSR from large organizations. So the farmer pays 20 rupees, and he gets primary health, which includes chronic diabetes, hypertension, etc., etc., etc. The price is right, and it is not episode-based. It is basically come for the full year and not yourself, for the whole family. This has allowed us to change consumer behavior in absolutely no time at all. We started off by thinking we'll do 10, 15, 20,000 patients. In a year and a half, we are doing 250,000 patients a year. And we expect we'll get to a number of 5 million in the next 3 years. So there's a lot of demand. There's a lot of misconception. And in the healthcare space, I think we forgot the second part, which is care. People just worry about health and curative and stuff like that. Our focus is more on wellness and prevention. So we say, come for your ECGs. We are the only company in the country that goes to the villages, to the farmers' homes, and perform a 12-lead ECG with artificial intelligence so we can predict if there's something going on. We do that for diabetes as well. So we've seen a lot of interest in this thing, and it's been a great journey. We have really been rewarded very well by goodwill.
Thanks, Dr. Sandeep. When we speak about primary care, normally the idea is about diarrhea, about antenatal care, about immunization. And here's somebody who's talking about primary care, and he's talking about 12-lead ECGs. He's talking about diabetes management. Is something changing in this country as far as the definition of primary is concerned?
Yeah, we're very right. Things are changing in this country. Out of about 1 crore Indians who die every year, 2/3 of them Around 66 lakhs of them die of non-communicable diseases. Not changing, it has changed already. 28 lakh of them die of cardiovascular diseases. 12 lakh of them die of diabetes and related complications. So that had to become part of primary health care, and with health and wellness centers, we are moving in that direction. But what we are missing out is we are calling it health care, but what we are doing is disease care. We are waiting for people to fall sick. We are going to people and screen them. You are sick, come, take treatment. We are not promoting health. If you really want to call it health care, keep those who are healthy, keep them healthy. We are not investing in that. Some of the initiatives like Swachh Bharat Abhiyan is contributing to that, but the focus of healthcare needs to shift to health, not medical care.
So thank you very much in kind of helping us to understand that the definition of primary is actually changing, and that in the delivery of services, the delivery of disease care, our primary definitions are now encompassing those which we used to call the diseases of aging or diseases of affluence. They are as primary. So the farmer would be definitely somebody who is also looking at a disease profile that includes diabetes, includes cardiovascular risks, includes neurological care. And so therefore, the question then is, back to you, 120 rupees, 250,000 people coming annually. Do you think there is enough supply of services, or do we need to look at a different way of now delivering this kind of primary care?
Well, you know, what we are doing is exactly what doctor said. We are treating healthy patients. We are trying to get them before they become sick. And we require a lot more. The government of India is trying to have 150,000 wellness centers. We intend to have a very small number of about 4,000, but that's, and we are currently at only 110, so we are doing this thing. Even if we do 5 million patients, I have covered 1% of the needy patients. You need a lot more than what we can do. You need a lot more of people like us and the government of India.
Very quick pivot. Another thing that Dr. Sanjeev said is that we are still thinking in terms of how we deliver disease care. How do we deliver health care in the way that we need to think about wellness? And Boss Reckitt Benckiser, people who sell Dettol and all the other things that go into making environments safe. And I'll come to Durex later. But where do you think this conversation goes in terms of wellness and preventive care?
Yeah, it's very interesting, like, you know, how, I will say, like, how the market is shaping up, and with the newer technologies and, you know, using more of the bots and the artificial intelligence and having privately owned blockchains. So this is the future, basically. Like, it's not just limited to urban, it's there for the rural also. You just talked about Durex. I would like to just, you know, focus on that point. Through the chatbot, which is called the RexBot. So through the RexBot, we reach around, you know, 7.5 million people. Already, you know, algorithms are there in place. You just feed your question, choose your question, and it replies back. What is there in the mind, what's in the body, what's there in soul, what's there on the STIs, what's there on the prevention part, what's there on the treatment part, seeing the doctor. It reduces, you know, there's a genuine conversation which happens. And, you know, more the people who will be participating, more the algorithms which will be formed. And better the algorithms are, better the replies. So that's one part. Second part is basically, you know, there are 3 pillars as per best of my understanding of public health. One is the prevent framework, second is the promote framework, and third is the treat framework. If, you know, there is a price capping on the OTC medicine, which is over the counter, definitely, like, there will be huge queues outside the tertiary medical centers and the primary health centers where people will be going for the cough, cold, and the very, very basic things. Instead of that, if there is a right labeling, if there is a right investment on the consumer education, there are high chances like people will be able to get, you know, the best of the medicines. You go to the stores in US and UK like Boots and others, you see the labels are so clear. And that can only happen when you don't have the price cappings on the basic things. For example, you cap price of Durex, you cap the price of some other condom, you cap the price of Strepsils, you cap something else. So slowly, when the P&Ls are negative, so companies stop investing there, and ultimate loser is basically the consumer. Because you can get the OTC medicine, you can get a lot of consumer communications. So if I have to run a PSA copy, which is a public service advertisement on rotavirus vaccination or on something else, I may not be investing because my P&L is looking negative. So it's a regulatory framework also of the government, like how that works and how it shapes up. This is my submission.
And I'll come back to you because there's something that's very interesting. When I started off talking to Mr. Kanduria, the thing that I'd mentioned was, or alluded to, was his life in California, and I mentioned chatbots. And very interestingly, Ravi, you kind of bring up this whole idea or this thing that's really live right now. What, 7 million people coming onto the Durex chatbot? Reckitt Benckiser is the world's leader in selling condoms. And so conversations around what is sexual behavior, how do I avoid STIs, sexually transmitted infections, or what is it that I need to do to prevent myself from getting HIV? That's a confluence of conversations that you've had as a technologist and now looking at health and people who are trying to deliver consumer healthcare goods. But let me pivot to you, Mr. Balaji. Vodafone. When people want to buy stuff and they couldn't figure out ways of transacting this business, Vodafone went clearly beyond the remit of providing telephony services to setting up M-Pesa in Africa and then coming to this place here in India. Where do you see M-Pesa or such innovations now play into the health ecosystem?
Excellent question, but maybe I'll pick up the thread a little bit of the conversation so far. So we've fortunate to be in an industry where we can make a huge impact in the lives of individual societies and nation. And it's so nice when Ajoy and my colleague from Reckitt Benckiser is talking about technology and blockchain and so on. Because we do believe that our entire, whether it's our company overall as a vision or whether it's the CSR initiative they undertake, is entirely built on the concept of connecting for good and how technology can shape the lives of people. To the point that you made on the prevention of diseases by educating, so that's a very good point. And frankly, there are at least a few initiatives that we've already undertaken in this domain. And most of them are evolving around creating virtuous ecosystems. So let me take the case of the entire thing around cardiovascular diseases. We said catch people young, catch them young, and therefore in West Bengal, for instance, we tied up with the government and district administrations, about 4,500 schools, 1.2 million people that have been touched by very simple multimedia ways of explaining how they can be healthy from avoiding cardiovascular illnesses. Same thing, we will actually tied up with the Indian Pediatric Society, with the government, the Health Ministry, and the Child and Welfare Ministry to actually pick up small things like videos on malnutrition. And 4 videos where we actually together could get Amir Khan to kind of provide that quotient of looking into this matter. And just picked up our own user base, which runs into about 250 million subscribers, and make sure that those videos could get propagated, and that we could actually incentivize people in a particular age group, particularly in the rural India, to kind of benefit from observing them. So I'm just giving examples of what we could just do in terms of saying commonly available technology, how do we make sure that we form partnerships and virtuous ecosystems to get simple solutions out there for people to benefit. M-Pesa actually falls in the same category, where we said that it is not, it is extremely important that financial inclusion and financial empowerment is important, even in small things like money transfer, which is where this whole thing started. And we've got many applications that have been possible by working with enterprises that want to get into using payments over mobile as a means to facilitate simple transactions in the health area, whether it's in cooperatives trying to move money from place A to place B, migrant workers having to send back money to family at home at 1/10, 1/20th the price of traditional challenge. So all of them are built on the basis of saying, how do we make sure we get partnerships? Because we wouldn't have been able to get money delivered in cash to rural India if we didn't have our distributors that were actually onboarded. The people used to collect money for prepaid, but told, you know what, with a little bit of more of KYC and some other incentives that we'll give you, you can ensure that you can actually do a social cause of transferring money for significantly lower using technology than you would have otherwise done.
Thank you. This is where I pivot to the audience questions. We've had one round of responses. We've kind of just scratched the surface of what each of our experts have either done or are doing or are thinking about. But I really want to kind of go back to Dr. Gambhir's question, because this kept coming back even during the jury conversations that we had while we were seeing the entries from all the companies for the awards here. And that's a very serious question, and I want each of us as an expert to also reflect on that question. There's citizenship, there's corporate citizenship. Both of them entail responsibilities as citizens. So therefore, when you spend money out of your profits, is it an extension of this social responsibility, or as a charge is being brought, is it more about burnishing your own brands? And so therefore, let me start with the corporates first and then come to the other two experts. Ravi.
See, what excites us, I just want to make a submission here. There is a young lady sitting here, if she is there. Pooja, can you just get up? So she is one of our colleagues, working with one of our partners. So she challenged us. She says, do you guys work on only P&Ls? So is it making the top of the mind recalls or getting equities of from doing the work and all that? So that made us actually really think, so what we actually want to do. So we thought let's have purpose imbibed in the mission of the company. We don't have CSR per se separate wing in our company. We believe in integration of national purpose with the brand purpose, with the company purpose. We'll give you a very small example like how it works for us. This is a dengue and malaria season after the outbreak in Kerala or now in Delhi or in other places. So millennials actually excite us. They tell us a new story. They say when I have a smiley, I can send you in the morning through my phone. Can't you have a an emoji which tells me the emoji goes from the health minister's desk and the emoji goes to every citizen, especially in the hotspot belts of malaria, dengue or chikungunya. You need to take care of this because WhatsApp groups have their limited reach. If you have an emoji, you have emoji for smile, you have emoji for hugging, you have emoji for everything. If I need safe sex, so can there be emoji for that? If I have to take care of myself and my family during this dengue season, can I send an emoji to millions of people who are there in my vicinity? So all these questions actually they trigger. So they all help us trigger, our resources. We invest in the future. We say, no, this is 2018, so what in next 5 years? Can we have, we do the NPD pipeline for the products, can we have the social innovation pipelines also? Instead of giving the donations to the companies, we ask for the match funding. We say, let's match it. I was just going through a very interesting scenario about girl-child education in Rajasthan, where they talked about educate girls. And there was a bond which is floated. I sometimes feel like this is time which has come for us also to float a social impact bond, maybe in the field of malaria, maybe in the field of sanitation, maybe in the field of hygiene. So things are changing, and it's not just spends, it's more about satisfaction and the leadership. Like our global CEO, Rakesh Kapoor, who happens to be an Indian, and from one of the villages in Bareilly, whenever he comes to India, he asks us, so what's happening in the villages? What's happening in the slums? Is there a difference between Bharat and India? Are we bridging the difference between Bharat and India? And if you can't, then Ravi Bhatnagar, you need not to sit in the position where you are sitting.
So the question that I can want to repeat both back to you, but I'll turn to Mr. Balaji here is this. Emojis or bridging Bharat and India, does there have to be the company logo, company branding behind that effort? Or how does Vodafone approach it?
I think he touched upon in part, but basically it starts with the purpose. The company's purpose, when we look at our own organization, is to connect everybody to live a better today and to build a better tomorrow. It's as simple as that. It is embodied right from the top to the last employee in the company. Frankly, we've increasingly moved to saying that we need to focus on what our core competence is and use that as a means to make social impact. And so we've started to create a lot of tools, a lot of IPR, which we're extremely happy to give away. So let's take an example. We've created a financial education package called Jadoo Ginni Ka. Okay, name is easy, didn't want to, simple enough, Ginni, as everyone knows. And multimedia, 10-hour programs, small modules, can be taught by anybody. We've just made sure that we've found partners that are willing to take it and take it forward, saying, okay, you've created this wonderful curriculum which addresses everything that a common man or woman needs to know. And we are very happy to take this on through our platforms and outreach programs if you just give it to us. Frankly, that's the way we designed it. So it's no longer ours, it's theirs. So effectively what we are saying is, we are moving from the point of saying that there is no way that you can make social impact or even live your purpose of making a better tomorrow if you do not actually focus on what you could do and hand it over to someone else who can actually execute it on the ground and make change happen. So that's the way we are looking at our work in the future. A scholarship portal that we have created. Purpose very simple. A lot of scholarships to be given. Many needy people, they just don't know how to access it. Multimedia as a means to explain. Multiple languages. Chatbot integration. IVR and call center integration. That's the stuff that we do normally in our business. But we said if we can use that as a means to solve social problems, then we should. And we're saying anyone who wants to use this platform, whichever way that they can reach out to needy people, the better it is. So that's how we are kind of working in a manner which basically is getting the power of everybody rather than trying to focus on ourselves as an organization. And the last thing is, if we have certain competencies in our employees, then we're actually encouraging them to utilize it to work in social sectors for short and sometimes even 6 to 8 week interventions. So someone who wants to do branding in order to get better outreach to get donors. Someone who wants to put a simple inventory management for a lot of stuff that's coming to them. NGOs, they're looking for that kind of competence, and that's available to them. It's got nothing to do with Vodafone, but the impact that it has on the employees and their morale and their self-esteem that they're making a social difference is our payback.
Right, and so I hope, Dr. Gambhir, you're hearing through some of the answers that are coming in. But I want to take this question back to you, Mr. Kandoria. You've kind of seen all these. Where do you see the future of corporate social responsibility, particularly in this space of health, really pushing itself and making itself more meaningful?
My personal view on that is that each and every citizen of India should have his electronic health record, and then taking technology to predict what is likely to happen over the course of time if the lifestyle is not changed or if management of the disease is not done. All of that technologies are existent. But what we have also found is that most of the rural India or most of the farmers of India are very reluctant to change. And it will happen over time. You have to build their trust. And another thing that we learned over the first few years of our work was that telemedicine did not work. It's a strange thing to say, but telemedicine did not work because they didn't want to talk to a telephone operator about something that was crucial to them. So we moved from telemedicine to physical centers. So when I say we have clinics, we have physical brick and mortar clinics in villages. And the other thing that we learned was the ladies and senior citizens did not come to the clinic. It's just not in their DNA until it's an acute care. So we started going to the villages. We hold health camps in the villages, which is where we have seen a huge amount of interest, where the ladies and senior citizens come, so which is where the real patient is. So I think outreach is very important. Trust is very important. As soon as they start thinking that you come from a city trying to take their money, the battle is lost. And technology is required. We have a large country, so technology, you capture them on electronic health record, that effectively also gets them on Digital India. And then using all kinds of artificial intelligence and so on.
4 decades of work, sir, in public health across India, academic institutions, UNICEF, across continents, and here's coming back a full cycle. We used to go into camps, we replaced that with telemedicine, and now we're kind of saying build outreach, build trust, build the flesh-to-flesh connectivity. What are you making out of this whole cycle that's coming through?
Thanks. That's a very important aspect. But before I get there, I need to respond to what Dr. Ajay Gambhir raised. Visibility and service. Every one of us needs some visibility. Doesn't government need visibility? They talked about Ayushman Bharat, the protection scheme, which is the largest in the country. So everybody is looking for visibility. There will be very few saints in the society. वो तो संन्यास लेके सेवा में लग जाएंगे. But most of us are normal human beings. We need visibility, but visibility with service. Service comes first when it comes to corporate social responsibility. So with that, we are at a very exciting time in India. Technology is going to change, not only replacing outreach, you are going to replace hospital. Brick and mortar hospital will become less and less. You will have virtual hospital. People, 5 of us sitting here will be wearing a armband which will be monitoring our ECG. Somewhere hundreds of kilometers away, will be recording my blood pressure, will be recording my blood sugar, and my mobile phone will tell me how many steps did I walk. That technology is available today. I don't know how many of us are using it. You take pictures of the food you take from morning till evening, it will tell you how many calories you have taken. So we have many important applications available today which we are not using. But I can tell you 5 years from now, virtual hospital will become a reality. First one is being built in Dwarka. So they will become a reality. So we will not have to visit doctors for blood sugar testing every month. A diabetic has to go HbA1c. You will not need that. It will be monitored continuous real-time basis, and hopefully before you get a myocardial infarction, somebody will call you up sitting in that room monitoring your progress wherever you are, lie down. We are arranging an ambulance to pick you up and take you. The bed in the intensive coronary care unit has been arranged. Before I get symptoms, my MI is picked up. I reach the hospital in time, I recover. I recover much faster and I recover fully. Similarly, for cancer diagnosis, you have early diagnosis treatment, you can be cured. So we are moving towards but we need to have some sense of urgency in using the technology which is available today. Scale it up, and that's where corporate social responsibility can play a very important role. Push for scaling up of these technologies which are available today to revolutionize health in India.
So let me ask you this question. I mean, to both.
Just one small thing. I think the point that were raised here both on trust is extremely important.
That's what I want to come
Trust and brand. I think to the extent that you leverage your brand to build trust in new initiatives that are doing in order to create social impact is useful. So if it helps you to, in our case, if Jadoo Ginnika can benefit by having a Vodafone thing to it which says, okay, this is cutting edge latest, then that brand association is truly worth it. So I thought I'll just make that comment.
So let me amplify what you're saying, because that was my question to both of you, not to the other two. Dettol, one of your brands, trusted, right? It stands for, I mean, it's almost like a generic thing, right? It doesn't matter which brand of chlorhexidine comes along, people tend to refer to that as Dettol. Or in your world, I mean, Vodafone, your Pug and the surrounding ecosystem, you built a certain amount of credibility around the service that you're providing. My question to the two of you, how do we take that expertise and how do we take that experience to something that, say, Grameen Health is trying to provide? I mean, chatbots or newer ways of virtual hospitals. How do we build trust into something that we don't know, we can't touch, feel today, and then figure out ways of delivering health? And how does that then allow for others who may have corporate social responsibility money to come on and be part of that conversation? So the two of you, please.
I think by being open to ideas, innovation will come at the edges from many organizations, from individuals, whether it's Ajoy's organization or anything else, and just need to kind of keep yourself open to ideas and say not all the ideas are going to come from within. And if you can just support them by, how do I say, by amplifying what they can do with your own core competence. In our case, it's about building up scale, it's about using our large reach across the country and our brand and trust. If that is worth in amplifying some idea that someone else has come with, wonderful. And by having the humility to say, even if you've come up with a couple of good ideas, that you need to create ecosystems and be willing to give more than take. I think those are the two things that would help us to kind of, get the maximum impact.
Ravi?
To me, most interesting thing is from you graduate from communication to engagement. If you are engaging with your consumers, because consumers' needs, their social strata, their nudge, their norms, things change very fast. So if really, we would like to retain the trust, want to be among the top few brands, so brand is doing well, so you invest more, which is India's law, 2%, So it's very important, rather than having the monologues, it's important to have the dialogue. And dialogue with the communities and in the way, so I say there needs to be a hyper-local communication solutions. Maybe what works here in Delhi, in this particular part, may not work in Rohini or may not work in Dwarka. So if we don't have the hyper-local communication, or I can say hyper-local engagement platforms, the trust will not be retained, and slowly, the top of mind recalls and many other things will fall down. What we are able to successfully do to build the trust is to reach out consumers very frequently and to do the sentiment analysis. Sentiment analysis is something which one needs to invest very heavily on. Until unless, sentiment analysis, sentiments are understood, you don't know where is the elephant in this room.
Sure. So let me take the last two words that you kind of did, which are new words in the conversation. You mentioned this word hyper-local, and then you kind of also did this pivot from communication to engagement and dialogue, right? I want to pick up the second question that Nidhi had asked from this table here, which is, her thing was around, so what's primary and why are we kind of looking at that? If you're hyper-local, then where's tertiary? If we're hyper-local, how do we know that what we are taking care of actually heads off what might then escalate to secondary and tertiary? Dr. Sanjeev, Mr. Kandori.
It's very important that we understand what is primary healthcare, what is secondary healthcare and tertiary healthcare. I will only emphasize on primary healthcare. Where does the healthcare begin and stop? Stops with the individual and the families. We conveniently take that out of the equation. We say health and wellness center is the beginning of primary healthcare. That is wrong. It starts with the family. We took an example of hypertension. 99.9% of the time an hypertensive is sitting at home. He goes to doctor once in a month, gets a prescription. Who monitors his diet? He himself or his family? Who monitors his physical activity? He and his family. Who makes sure that he takes the medicine as prescribed by the doctor regularly? Who monitors when he gets complication, he goes to hospital? Family. So in primary healthcare, my suggestion to everyone is that please include the family in primary healthcare, otherwise you will be making a blunder. Thank you.
Sir, taking from your cue, one of our mentors told us, our health card was for the couple. And he says, that's not enough. You need to include the whole family. And we said, okay, we'll increase the rate. He says, no. That's not what I said. You need to include the family. Our goal, and this, I'm taking 2 steps back. I was in the technology space, as Balaji knows, and we were colleagues in that. Taking 2 steps back, because when you go to rural India, the DNA of the person there is very different. Most of us are not aware of that. The DNA is different. Yes, you require technology to be able to monitor them and provide them wellness, but to get them comfortable to get there, you have to get them on an electronic platform. In our opinion, what our goal is, we want to be their family doctors. We do not want to charge them for it. We want them to come to us, talk to us about anything and everything. For example, if the Prime Minister's Ayushman Bharat has to be successful, somebody needs to explain to the farmer what it means, what are his rights, and where can he get the benefits. Who is doing that? I don't think there is any process in place for that. You get a letter, now you are insured. Okay, what next? We want to go to people's homes, get them included in the EHRs, electronic health records. Yes, use technology, but also continue to educate them on what is available, what is good, what is bad, while not charging them for it. As soon as you start charging, they are reluctant to talk to you. They'll come only when there's a problem. We want our farmers to come to us when they are well and hopefully remain well in the process. So we just want to be family doctors to the farmers.
Thank you, sir. Key words from the last 25 minutes that I want to kind of sum up with, that I've heard and hopefully you've heard, and if you haven't, let's kind of do a quick wrap up of what we've heard or what I'm sensing here. That the game is going to be where the individual and his family or her family is situated. It is not going to be 50 kilometers away. It's going to be where they are at. In order to get to where they are at, we need to have newer tools or use the tools that are emerging to be able to reach them. Not in a broadcast manner, but in an engagement and a dialogue manner which builds trust. Trust enough for them to be able to then talk back, whether it is to the operator or whether it's to a chatbot or whether it is to an electronic health record system, so that their records are now available where they are at to be able to predict what their health situation is likely to be. And if that kind of a predictive capability is now possible, then to be able to also deliver the kind of services right in the same hyperlocal situation that they are at. So that we are now looking not at disease program delivery, but we are now looking at preventive, promotive, wellness delivery services. And if in the process of doing that, we have different competencies, either building trust or the ability to communicate via branding, or actually feet on the ground which our money can actually buy or support others to do so, then that is truly corporate citizenship. That is corporate money being put to good use in building the health of the nation, and that then provides meaning to the whole umbrella term of corporate social responsibility. I hope I've tried to capture all of the keywords that have been said this evening, and I hope that this is food for thought for those of us that are here in this room wondering, why didn't we get an award? No, it's not because you didn't do your job. Awards are only a signifier of greater responsibility, as our Honorable Minister earlier said. ये गले पे एक नया हार आ गया जो कहता है आप और कुछ कर लो, क्योंकि ये आपके ऊपर एक जिम्मेदारी आ गई. लेकिन when we are part of this, we are not doing it because our brands are involved, but because we are collectively in it, because together we form a community, together we form a nation, together we form the health for the world. Thank you very much, colleagues, for being here on the stage with me. Thank you all for being part of this conversation.
Thank you, Dr. Bobby John. I would request the panelists to please stay on for a minute. I would also like to request Kamal Narayan to please come on the stage and give a memento to our esteemed panelists who have had such an invigorating panel discussion discussing what is happening in CSR in India when it comes to healthcare. What is the motive of an organization or a company going ahead to do something when it comes to health CSR? How can outcomes be improved? It was indeed a very invigorating discussion. Round of applause for the panelists, please. A big thank you to all the panelists and Dr. Bobby John for conducting such an interesting discussion on how health outcomes can be improved by the CSR initiatives undertaken by companies.